Good afternoon, everyone. Thank you for joining us. This is a very powerful presentation. I'm Ron Mizutani. I'm the president and CEO of PBS Hawaiʻi, and we're grateful that all of you chose to be here with us to discuss and to listen and learn about a very powerful subject and something that's hitting very close to home, perhaps closer than we all knew. And again, we appreciate you having this sneak preview of the Indie Lens pop-up film, Love in the Time of Fentanyl. The episode you just saw, by the way, will be airing on Monday evening at 9 on February 13th, here on PBS Hawaiʻi. And we'll remind you at the end of this panel discussion. Also be available on demand at pbshawaii.org. I want to say aloha to folks from Baltimore joining us today. I understand there's a few of you here. Winnipeg, Canada, thank you for joining us. Wahiawa, Vancouver, Minnesota, and also somebody joining us from Mexico this afternoon as well. Mahalo for being with us. And I also want to thank our panelists here, and I want to introduce you to them joining me for some Q&A, and we welcome you to ask questions, get to as many as we can. Dr. Kimo, Alameda, Vice President, Hawaii Island Community Health Center. Dr. Kimo, mahalo for joining us. Heather Lusk, Executive Director, Hawaii Health and Harm Reduction Center, and a good friend of PBS Hawaiʻi. Heather, nice to see you once again. And Tim McCormick, Chief Harm Reduction Services Branch from the State Department of Health. And we appreciate the DOH being a part of this conversation, Tim, very much so. In fact, I'd like to start with you, Tim. Set the stage, if you will. What is harm reduction? We heard about it in the film. And what are we doing here in the state of Hawaii? Are we doing something similar to these programs, and why?
Great. Sure. First of all, mahalo for including me on this really important topic. So harm reduction is a public health strategy that aims to reduce the harmful physical or social impacts of various behaviors that people engage in when stopping that behavior is not always realistic. Harm reduction is used in a wide range of behaviors, but it started, and it's really best known as a response to drug use. So abstinence or quitting drugs and maintaining sobriety is one way to reduce the harmful impact of drug use, but harm reduction is about finding a way to reduce the harm for every person whose drug use is causing harm, including those who are not currently ready or able to quit. So harm reduction includes the entire spectrum of changes people can make up to and including abstinence. And in terms of harm reduction in Hawaii, syringe exchange is a great example, and one where Hawaii was an early leader in harm reduction. So the state started sterile syringe exchange in 1989, and for many people in Hawaii who inject drugs, the syringe exchange program, which Heather Lusk's agency currently runs, has prevented countless HIV and hepatitis infections, prevented people from dying of overdoses, and has been successful in helping people to dramatically improve their lives over time by supporting them in making whatever incremental positive changes they were ready and able to make.
You keep saying that, and that's very interesting about ready and able, because some people are ready, some people are not able. And I want to talk to Dr. Kimo about that. But first, Heather, what are we doing to erase or try to eliminate some of that stigma? Because the reality is this, and Dr. Kimo will get to this could affect anybody. This is not just drug users or those who are facing addiction. This is a real issue that you and I could stumble across.
Yeah, and the data in Hawaii shows that it can be, and Dr. Kimo will answer more about that. I think when you talk about stigma, silence kills, stigma kills, and there is a lot of stigma around substance use, people being afraid to share that they're struggling with it. One group of people that have a higher rate of overdose is people who may have had a period of sobriety or abstinence, and then they either relapse or use again. And again, often that is in with shame or embarrassment. And so by addressing addressing both substance use and overdose in a non-judgmental, compassionate way, we really acknowledge that for many people, they're using because of adverse childhood experiences or early trauma. There's a high link with using substances, particularly injecting substances, and early childhood trauma. We see people self-medicate because, again, they are struggling. We have, generations of trauma here in Hawaii that people may be dealing with. So addressing stigma is about looking at the whole person, but also acknowledging that if we don't don't talk about substance use, if we don't talk about overdose, we're pushing it in the shadows. And that is where the true harm happens. And that many of us believe that connection is the antidote to harm when it comes to substance use, and helping foster that connection, which is something that the Hawaii Health and Harm Reduction Center does, in addition to providing naloxone to help prevent overdoses, which is the single greatest thing that you can do to address the stigma, is carrying naloxone to be ready to save a life.
But what an uphill battle we face, because this drug is so unpredictable. Dr. Kimo, the numbers are sobering on Hawaii Island, and you're on the front line. Tell us about what's going on there and the efforts you, your team, and many others are doing.
Sure. Thank you, Ron. And what a profound film. Thank you. This reminds me of all the work, why we do what we do. Well, I know on the Big Island, one person every 11 days are dying from an overdose, mostly associated with fentanyl. Now, the whole addiction situation is, when I talk to kids and I say, hey, this is the addiction cycle. You go from I like it to I want it to I need it. And when you're in I need it, your brain has flipped to the addiction mode, if you will. And you're right, addiction's a brain disease. It's like heart disease. Nobody chooses heart disease. You might have a mac salad today and you might not exercise tomorrow, and all of a sudden you get heart disease. Well, same thing with addictions. You experiment, with some alcohol, and then maybe you drink more, and then you smoke a joint and you vape, and now you're doing cocaine, and all of a sudden your brain jumps to addiction. So it's very tough, and the movie was very tough to watch because those folks are really feeling it. But they also give me a sense of hope, and hope is, hey, hold on, pain ends. But you got to hold on, and so we got to keep folks alive. And so harm reduction is about keeping folks alive through Narcan, or what's now we're trying to push on the island is fentanyl test strips, because it's hard to just quit cold turkey. And so these are some tools that we can use while people are trying to work on their recovery.
So I'm going to ask this question to anybody. Feel free to answer it. And I already have a very, very powerful question that I want to get to as well. What of those who say, hey, and maybe it's because of ignorance or not educated or on the issue, or just curious, aren't you enabling by using this approach? I don't know. Maybe people don't think that way, but I know that's something that I thought of. And it was very difficult to watch this film, and I've seen drugs affect close family members as well. But are we enabling those who are getting risk fentanyl addiction and even death?
If I can jump in and go first, if you're talking about things like preventing overdose deaths and preventing people from getting bloodborne infections like HIV that will last their lifetime, you're preventing something that is not going to change. So I think that it's not a question of enabling them. It's a question of keeping people safe as possible until they get to the point where they're able to make that really difficult change of getting out of addiction. So I see it really as supporting everybody, not just the people who are at that point of really being ready to make the change, but supporting everybody and just trying to keep them safe and alive.
Yeah, and that's what research shows too, Ron, is that when they've researched programs like syringe exchange programs and other programs that work with people to meet them where they're at and working with people that are actively using, the research finds that actually not only does it not promote drug use, it actually has the opposite effect. And you might be surprised. And what it is that when programs and people are shown that you're of value, that regardless of where you are in your use, that your life matters, that you are a person that is deserving of respect and dignity, when you may be ready, willing, or able to explore treatment or a different path, guess who they come to? The very people who have been there the whole time. Whereas people that really struggle with stigma and feeling like nobody wants them unless they're willing to do certain behaviors or go down a path they're not ready to, then they really struggle with, if they are ready, that they don't have that connection. So this provides that connection. So once they may be ready, willing, or able, they know who to go to, who can help them get to whatever next step is their goal.
I imagine, Dr. Kimo, you're getting that trust. You need that trust within each other as well. And that trust factor is huge when it comes to recovery.
Absolutely. We just had a planning meeting today on looking at what does the next 5 years look like if we were to reduce the overdose deaths on our island and statewide, as well as reduce the almost deaths, right? And we had a lot of folks participating who are in recovery. And they said, hey, Kimo, nothing about us without us, okay? So we want to be in on this. And that takes a lot of trust. And those are the folks that we're looking towards, who have that lived experience. And that takes trust of government officials, of academic folks, to folks who are the true warriors, those who are doing the outreach, those on the streets, those in recovery.
Thank you for bringing that up. Kind of goes right into this question that somebody just provided to us. Who helps the helpers to prevent them from falling over the edge and having to deal with their own helplessness when they see no end to the pain that drug users go through? And I think you talk about people trying to recover, yet they too can fall over the edge. Who helps them?
Yeah, that's a good point. I can tackle that one. So in Hawaii, we call that Aloha Fatigue. So how do we prevent Aloha Fatigue? And in our profession and in the helping profession, helpers need help too. And I know for me, we make time to talk about it, to debrief about it, and to use each other as support, similar to how folks in recovery use each other for support. So I think that group support really helps. I don't know, Heather?
Yeah, no, I'm right there with you. The kind of we call it compassion fatigue, aloha fatigue, but that idea that it causes suffering to see so much suffering in other people, and how do we support them? There are a couple new initiatives. So one is if you call the CARES line, the 832-3100, there's a new group run by Debbie Atkinson that's for families. There's been a real need to support the families of people struggling with substance use. So that's one new effort. And then the other one is, I think, the governor's new office on wellness and resilience is really going to be focusing on what can we do as communities to affect both the community level trauma, but also individual resilience, and really acknowledging this idea of vicarious trauma, that people who are supporting those that are struggling can experience just as much of that same fatigue and burnout and need that mental health and wellness support as well.
Tim, I imagine being with the State Department of Health, I mean, you have your own type of fatigue because in many ways you have some limitations when it comes to liability and everything else. But how does a DOH approach that?
Well, I think the fatigue that I may experience as a bureaucrat is nothing compared to the people in the film, the people who were doing this work in the street, the people on Heather's staff that go out on the street providing street medicine, engaging people in really difficult situations. I think those are the people that, as a system, we really try to make sure that we're supporting those people. As you can imagine, as you can kind of gather from the film, burnout in those jobs is really difficult. The job of an outreach worker is really amazing work, but I think it's really taxing. And that's the burnout that I worry most about.
Another viewer just said something. Bravo to those who work for and supported OPS. Also bravo to the filmmakers for bringing this to the masses. And I'm grateful that PBS Hawaiʻi can be a vehicle to share this very powerful film. The person says, this is not rocket science, though. This is love. Where is the reverence for every living being at the political level? We know this isn't free. This costs money. This takes support of decision makers. How do we engage them, Dr. Kimo?
Yeah, what's interesting is I think we talked a little bit about this off the air. Addictions affect every family. I don't know which family it doesn't affect. And so legislators, they're brothers and sisters of somebody who is stuck as well. And I think we just have to bring it home. When I do my trainings in the schools, I ask kids, raise your hand if you know anybody stuck in I need it. And doesn't matter what school, public, private, charter school, 60% of kids raise their hand. That's 60% of our island and our state struggling with this problem. And so if legislators can realize that, this is not those guys, this is us, then I think it's hit home quicker.
Oh, I tell you, I know many legislators, lawmakers, law enforcement. It is definitely us. Heather, you look like you wanted to say something about that, because I want to ask you, how do you enlist the love of people corrupted by, and this is a question, so I'm not going to paraphrase, corrupted by money and power?
Yeah, no, it's a great question. Well, one thing we've been working at doing more here, and Kimo mentioned it, is really centering people with lived experience and having them testify and share. So we've been able to bring people that have survived an overdose or experienced, one of our staff had their mother overdose or their own struggle in recovery, and having them testify. So for example, SB 671 this session would make fentanyl test strips legal. And we, Kimo, many of us believe that this is necessary. So having people impacted by fentanyl being able to share their story is one way that we have found, because again, it shows you that, again, this could be your kid, this could be your partner, that this is impacting all of us. And it's that humanizing that helps them see that we're just 1 degree of separation away from this being us, ourselves, our neighbors.
Because fentanyl is sneaking into not just, but other things. I mean, and a lot of these folks who are, we have someone from Minnesota joining us today saying the entertainer Prince, as some of us have heard, allegedly died from an accidental overdose of fentanyl. Medical examiners had found fentanyl is ending up in drugs. I don't know why somebody would be so sick to do that, but it's true, and it's affecting those kids who have no idea. Those adults who have no idea that fentanyl is ingested.
Yeah, it's 100. Oh, sorry. Go ahead.
No, you're right. Heather was going to say it's 100 times more powerful than morphine, 50 times more powerful than heroin. So why would the drug dealers do this? Because it's about money, and they want their customers to get a high. The better the high, the more addictive it is. Now they have a revenue stream. But it's killing folks, right? So why would they want to kill their customers? Well, if you're stuck on a drug, you don't think that's going to be you, number one, because you just want to get the withdrawals away, because the craving is so tough, the withdrawals are so bad. So that's why this is where medication can also be helpful. So this is why we have like Suboxone as something else that's in our toolkit that physicians can prescribe to kind of help folks stabilize the craving so that they can get treatment. So we have a lot of options out there for folks. But you're right. Yeah. I mean, why would you want to kill your customers? Well, guess what? It's about money. And those who are stuck on a drug don't think it's going to be.
I know the fentanyl strips is a bit of a controversy right now, although it is a tool being used really across the world. And I know that folks here in Hawaii want to use that as part of their tool chest, if you will. Maybe Tim, maybe you can share what happens when that drug is ingested or to reverse that effect so quickly. For those on the call watching, how does that happen so quickly? What's going on there chemically that's changing that, reversing that, flipping that?
So actually, I think I'll let Heather take a stab at that. But I will say that the health department does support the legalization of fentanyl test strips as a really important step in helping to prevent accidental fatal overdoses. So Heather, I don't know if you can take that question.
Yeah, no, thank you. And the health department's also provided thousands of naloxone doses across the state. More than 30,000 doses have been distributed statewide since Governor Ige signed Act 68 in 2016. And so what naloxone does, by the way, it's a very safe drug. It cannot get high from it. You cannot divert it. It doesn't affect you at all unless you have a dependence on opioids, because what it does is that it basically blocks the opioids in your brain by bonding to the receptor, and it gives people anywhere from 30 minutes to 90 minutes. It's in some ways it's like a short band-aid, because it's going to allow them to breathe for 30 minutes to 90 minutes, but they could go back into the overdose afterward if there's a lot of fentanyl or powerful opioids in their system. But it is a very safe drug. In fact, the FDA is considering making it over the counter. It's that safe. So we really encourage people to carry it, because you never know when you might be able to save the life, especially given how hard it is to get EMS to some of our rural points. Yes, Dr. Kimo, we can talk about half an hour between 911 call and EMS showing up, and naloxone may be the difference between saving the life until EMS arrives on scene.
It's almost like having a defibrillator in every office.
Exactly.
I mean, it's that common, if you will, or that effective as well, can save lives. Yep. Dr. Kimo, I think we spoke offline about this, but I want to ask in front of the audience. There's been a lot of hysteria, a lot of misinformation when it comes to fentanyl. People say, well, if you just touch somebody, it can go through your pores. Maybe if you could help shed light on that, and maybe even dispel some of those myths and misinformation.
Sure. Yeah, so fentanyl doesn't absorb well through the skin unless there's a cut, or unless it's mixed with other chemicals, because there is something called fentanyl patches that the doctors give their patients. But yeah, that's a total myth. And so, going back to naloxone, these things, on a big island, like one person every 11 days are dying from an overdose, mostly associated with fentanyl, but 3 people every 11 days are being saved. Wow. By naloxone. I wanted to jump on what Heather was saying. But that's probably the biggest myth, that you can just somehow get it and it can be absorbed through your skin. Now, if you have a cut, yeah, then it can be absorbed that way. But yeah, I don't know, Heather or Ron?
Yeah, no, agreed. And mucous membrane's the only other one that I've heard, so that, you want to cover your eyes, but basic universal precautions will protect people wearing gloves, wearing a mask, if there's any powder. So we have not seen the kind of incidental occupational overdoses that we were worried about early on in our first responders.
So, question from Sydney, and I open this up to any of on the panel. Would you say that this program could be trigger to former users of any substance? Being around users and drugs could trigger one to gain the urge of wanting to use again. So it could be that putting themselves up for a test to acknowledge their strengths. I think that's a great question. Even for someone who's on the front line wanting to help, does this put them at risk to fall?
I'll be honest, it could. We have seen some of the strongest people in harm reduction are people in recovery themselves, because they've been there. At the same time, only people themselves know their recovery. And so, for example, I've had some staff say, you know what, this is hitting a little too close to home. My recovery is too important. I need to switch jobs. So, so that is something that can be. And I think talking about it in supervision, again, addressing things like compassion fatigue are ways that we can support people in being in recovery and knowing if they may be getting into that slippery slope where it is hitting too close to home, or they are feeling themselves be more vulnerable to the triggers, or whatever you want to call them, of being around the program.
Tim, how do you jump ahead of that, Tim?
But what I think you really saw in the film how intense this kind of work is, and it's certainly not for everybody. You've got to be able to manage the stress of dealing with people who are just in really difficult situations, whether you yourself are in recovery or not. It really, the staff needs to be supported so that they, that they can continue to do the work, and that they know when they need to take a step back from the work. So their own recovery is just kind of one piece of that. I think most of us probably would not be able to do that work for very long. So I think, that's an important question. It's really something that agencies like Heather's that run these programs need to make sure the staff are being appropriately supported for that sort of reason.
You see, you hit the nail on the right there with it's almost got to be in your DNA, doesn't it, Dr. Kimo? I mean, these are special people who obviously been through it, been there, done it, like you said. They want to talk about it. What did you say? What did the fellow say? Don't use it without using us as a voice. Yeah. Question says, if fentanyl is so dangerous and addictive, why is it used in hospitals? Good question.
It's very effective.
Go ahead.
It's very effective. It's a strong pain medication.
Pain relief.
It's the same reason it's effective is the reason it's so problematic for people who use it for other reasons.
You can use it once and that's it. You can be addicted that quickly, Dr. Kimo?
I don't think so. Not if you're under proper monitoring by your physician.
Thank you.
But you could have a pill that you don't know has fentanyl in it, and that's why we also have a phrase, one pill can kill. And so that's why we tell folks, don't ever take anything that's not prescribed, that you see just laying around there, and that can be dangerous.
How can folks support programs like the OPS and programs that we have here at home?
Well, there are a couple different ways. If you're on Hawaii Island, I've found out about the fentanyl task force. Yeah, Dr. Kimo, I think there's a lot of efforts happening there. There is the statewide Hawaii Opioid Initiative, which you can go to www.hawaiiopioid.org, where it lists there are 8 work groups that are continuing to work around all opioids, fentanyl included. There's also a list on there of where to get naloxone and plug in. So those are a couple of the ways that you can get connected. But the biggest way is get naloxone. So just to do a plug, if you go to our website, you can order it for free, hhhrc.org/naloxone. And if you watch a 15-minute video, then put your name in, we'll send you naloxone in the mail. So that's one way that you can carry it. Again, it's very safe. It can't get misused, and you might have it when you could save a life.
Unbelievable. I have to wrap things up. I want to hear your closing thoughts. With Tim, we'll start with you, then we'll go to Heather, and Dr. Kimo will end with you. But Tim, your final thoughts on this whole subject matter, this opportunity to learn this powerful film and really other issues that we can do to support.
Great, thanks. So I think my final thoughts would be that fentanyl and opioid misuse are affecting our communities, and the people that are struggling with these issues are our ohana. So we touched on a number of public health strategies that can reduce the harm and help keep people alive until they get to the point that they may be able to put all of this behind them. So stigmatizing, shaming, and marginalizing people struggling with addiction and substance use issues does not prevent these issues from happening, but rather they just make it more difficult for people to get better.
Thank you, Tim. Heather.
So break the silence, talk about this, talk about if you're worried about somebody, ask the question and have a non-judgmental response. If you know somebody that may be struggling and needs access to treatment, you can call 988, the statewide crisis line, 24 hours a day, and ask for access to substance use treatment. There are treatments like Suboxone or buprenorphine that are very effective at managing opioid use disorder. And again, carry naloxone.
Thank you. Dr. Kimo.
Thank you, Ron. Yeah, so again, addiction is a brain disease. And again, hardly anybody goes from chocolate candy to fentanyl. So we need to be aware alcohol can be addictive, marijuana, vaping, and then the harder drugs, right? Cocaine, meth, heroin. And folks always ask me, Kimo, what is the most dangerous drug? And I tell them the drug that you're addicted to. So be careful, folks out there. If you're on a path to addiction, or if you know somebody who is, just know that it's tough, but and just be there for support. And there are treatments out there. Just got to go reach out and go get them.
Just got to have hope. Yeah, just had to have hope. Kimo, Dr. Kimo, thank you for the good work you guys do on the front line, and Heather as well, and Tim for the State Department of Health's support in this issue, which is becoming it is here. It is definitely here. We want to thank everybody for joining us this afternoon. What a powerful subject this has been. Sorry we couldn't get to all of the questions. We appreciate the questions. We appreciate all of our visitors from across the country and across the world. PBS Hawaiʻi will be sending you an audience survey, if you will, through the email. So please fill it out. We want to learn how we can get better at this, and your insight and feedback goes a long way. Also, you're going to see a QR code on your screen. Please consider giving a gift to PBS Hawaiʻi. Thanks to viewers like you, we can get these kinds of programs and free virtual screenings and events to programs like these. Simply scan the code and it'll send you straight to our donate page. Don't forget, if you missed it, or you want to share with your friends and family, the live broadcast and broadcast premiere of this film is on Monday, February 13th at 9 p.m. right here on PBS Hawaiʻi. Also available on demand at pbshawaiʻi.org. You also may be able to find a recording of this panel discussion on our website with a easy for me to say, downloadable website information so that you can get help because it's out there. You just have to find it. You just have to ask. Again, on behalf of myself, our panelists, and the entire PBS Ohana, I want to say thank you for joining us. Guys on the panel, thank you. You have my word. PBS Hawaiʻi will be here to use this as a tool. Use this as a tool to get this message out and save lives. We want to be there for the community as well. So you'll be hearing from us because I want to see what this is like on the front line. We got to bring this home, and this powerful film helped open some eyes, I think, today. All right, take care. God bless. Hug your loved ones, and until next time, aloha.